Good morning, afternoon, or if you're even watching this. So this is just the notes over the eye. We will probably do a crash course on this since we lost the day due to snow, but just want to, because we will dissect the eyes. We got them. We're gonna dissect them. So this will be a picture that we'll eventually label. So anyways, we're talking about the eye. We're just gonna talk about some structures here. So um, when we think about your eye, we think about protection. So the eyelid basically covers and protects the eye. It's very thin skin. Because what'll happen is the skin will not protect from intense radiation. That's why we have those. You go to tanning beds, right? Hopefully, you're putting those little goggles on. Really, you shouldn't be going to tanning beds, anyways. Not for me to judge, but because your eyelids, that skin is not thick enough to protect your eyes from that UV radiation as you're trying to get that nice golden tan that'll eventually turn to wrinkles later. But anyways, so conjunctiva, that's coming around the eye. It's under the eyelids, and sometimes, so some of you may have had conjunctivitis. If you look in that lower right-hand picture, that's some pretty extensive conjunctivitis. It gets all kind of like snotty and stuff, but basically that's another layer of protection. And so when we talk about the eye, we also talk about some of the muscles. Again, you're not going to be expected to label these, but there's the superior rectus, superior oblique, medial, inferior. And so again, if we had time, we'd spend more time on the eye. You're going to be dissecting a cow eye, and so you'll see some of these things. Also, we talk about eye structure. We talk about the glands. There's a lacrimal gland. They're the largest set, and these are what kind of produce tears, which drain your nasal cavity via the lacrimal duct. And so your lacrimal duct, right, it is right down in here. So we talk about the lacrimal. And so you can see a little bit more. There's the lacrimal sac. There's the lacrimal gland. So actually your tears start down, then they move across the eye, so on and so forth. The outer tunic, so this is basically the cornea, the sclera, and the optic nerve. And what the outer tunic does, the cornea it's transparent, it focuses rays of light. The sclera is just the continuation of the cornea going toward the back of the eye. It's the white of the eye. And then your optic nerve, it exits at the optic disc and transmits visual information to the eye and brain, so that runs back. Keratoconus is an eye condition in which the normally round cornea thins and it kind of like cones out like a bulge. So if you want to see more about that, feel free to click on the link. So here's some more structures here. You've got the middle tunic, which is the choroid coat, which contains your blood vessels. You have a ciliary body, which holds the lens in place. You got a lens, which is used for focusing. You have your iris, aqueous humor, which is the liquid part, and then you've got your pupil. And so the inner tunic with your retina, you may have heard that, that's visual receptor cells. Fovea centralis, it's just the region of vision. Macula, you may have heard of macular degeneration, excuse me. Optic disc, this is where your nerve fibers leave the eye, and then it's where you get your blind spot, and then you also have your vitreous humor. So here's your retina, there's your rods and cones, and this is where the photoreceptors are, which are the retina is what really is the area which are sensors for light. And so your rods are the monochromatic, excuse me, black and white, and then your cones are for color vision. And so we won't be able to talk much about. We're not going to get into much about how vision, but we talk about vision, how your eye works. So we have to talk about light refraction. And so what happens is light bends around objects. So images viewed by the eye are usually upside down sometimes. And so, but here's another image of the eye. We're not going to get into this. So if you stare at the dots for like 20 seconds and look at a wall or ceiling, anyways, it didn't work because I looked at the door. But anyways, give it a shot. So accommodation. So accommodation is this idea that lenses will change shape to facilitate focusing, and really the shape changes dependent upon these ligaments that hold your eye in place. So you see a relaxed eye, right? You see that D for distance, and then you see a closed focused eye. You can see how it's kind of pushing back. So again, we do have difficulty interpreting images that are upside down. Which one's the real Mona Lisa? Yep, that one's kind of creepy on the right. So your pupils, fun fact, when you're looking at someone you love, your pupils dilate, and they do the same when you're looking at someone you hate. So, anyways, just in case you want to know, fun fact. So what causes red eye? I don't know if they have so much, now you have those filters on your phones, but the flash on a camera is bright enough to cause a reflection off the retina, and that's why you often see red eye. Um, but many cameras now do have that red eye function, and these cameras, the flash goes off twice, once right before the picture and once again after, and so the first flash causes the person's pupils to contract, reducing that red eye. So let's talk about some problems with eyes. Cataracts, there's clouding of the lens, and so if you look on the left, that's a healthy lens, and on the right, it's unhealthy. That's with the cataract. So often treatment is removal and replace artificial one. If you don't want to watch eye surgery, don't click on this. Also, you have problems with iris and pupils. The function is to constrict or dilate the pupil. Therefore, it regulates the amount of light passing to the visual receptors. And iridia is a condition where a person is born without an iris. You can kind of see that there. Um, Onchocerciasis, I butchered that, but that's river blindness. We'll just call it river blindness, and that's when you get a parasitic worm in the eye. Symptoms include like severe inching, bumps under the skin, and blindness. So you can kind of see the worm in the eye. You may not. You may just want to cruise on past through this. And so, why are babies born with blue eyes? Melanin is a brownish pigment that adds color to your eyes, hair, skin, and at time babies are born with melanin hasn't been deposited yet. Hence, they appear blue. About after 6 months, eyes will change color depending on the amount of melanin. If you got a lot of melanin, your eyes will turn dark. If you have little, they'll stay blue. And if you have no melanin, sometimes your eyes may appear pink if you're albino. Color blindness, right? That's a genetic trait. So you can see the letters 25, 29, 45, 8, 56, 6, right? You can kind of do that. The blind spot is this optic disc, and it's a region where the optic nerve and the blood vessels goes in and out, and there's no photoreceptor such as your blind spot, so that, if you've driven, you've seen a blind spot. So if you hold your hands out at a 45-degree angle, that's the location of your blind spot. So this about here, you can still see your hand because the eye sees it. Close your right eye and look for your right hand. You'll kind of see that, but we may do blind spot in class. I just got to reevaluate the week. Problems with vision. You ever seen those things called floaters? Sorry, my phone was blowing up. They're when a capillary breaks and the cells break off. Floaters don't actually move. The eye just tries to track them. And so if you've ever seen floaters, retinal detachment, right? That's a retinal tear, and it occurs when the retina is pulled away from its normal position, right? And it's very serious. It can almost always causes blindness unless it's treated. So you have to get a retinal detachment treated. Glaucoma is the second most common cause of blindness in the U.S. And so with glaucoma, there's this pressure builds up. And as you can see, that pressure builds up and it damages the optic nerve. Hyperopia is farsightedness. You can see distant objects fine, but close objects appear blurry. So if you got glasses or contacts. Myopia is nearsightedness. You can see objects near but distant. Astigmatism is when a cornea has a regular shape and part of the field of view is out of focus. So if you look at a normal E, right? If you look at one with astigmatism, you can kind of see the difference there. So LASIK surgery, again, that's just kind of showing you removes tissue from the cornea's internal areas. Again, if you don't like stuff messing with your eye, don't Google this. So there's real LASIK surgery we're set for later. So anyways, that was my quick overview of the eye in about 8 minutes. This was just, we'll see what we get done in class. So again, hopefully you found this helpful. Let me know if you got any questions, and I'll see you in another video. Sign off from room 102, Tiffin, Columbia, beautiful, Tiffin's beautiful south side. We'll see you.